Dr. Gandhi, can you please rotate your device for better video? Sir, just टेढ़ा कर लीजिए उसको
ऐसे कर दीजिए सर डिवाइस को.
Dr. Gandhi.
Can we just turn it like this? Dr. Gandhi, can we just rotate the device to a horizontal way? Yeah, that's fine.
Is it okay?
Yes, this is fine, sir.
Okay, then.
Absolutely fine. Just take your place so that we can start.
Yeah. Okay.
Should we begin, Salman?
Yes, sir. Absolutely. Yes.
Awesome. So we are going live now, everyone. So 1, 2, 3. Welcome to BW Healthcare. I'm the CEO of Business World Healthcare and Wellbeing. My name is Arvind Narula. And there are almost 4 crore people in our country who are affected by asthma. This is around 11% of the world asthmatic population. But what is even more alarming is that around 42% of that asthmatic related deaths happen in our country. And on this World Asthma Day, I'm joined by 4 leading experts from across the country. We'd like to know from them everything and anything related to asthma. Let me welcome our guests. We have with us Dr. Mrinal Sirkar, who's the Director and Head of Pulmonology and Critical Care from Fortis, Noida. We have Dr. Satyanarayan Mysore, who's the HOD of Pulmonology and Lung Transplant Physician. He's from Manipal Hospitals. We have with us Dr. Vivek Nangia, Head of Pulmonology, Max Healthcare, Saket from Delhi. And we also have with us Dr. Subhakar Kandi, who's the HOD of Pulmonology from Kamineni Hospitals, Hyderabad. Let me begin with you, Dr. Sarkar. Whenever people are having breathing problems, especially kids, there's a fear that this could be asthma. Now, when does one know that it really is asthma, and how would you differentiate between pneumonia, bronchitis, and asthma at an early age? So you are muted.
So for a respiratory physician, that's fairly easy. A pneumonia would be an acute event needing associated with fever, apart from the respiratory rise in respiratory rate and cough and sometimes bringing out phlegm if the child is older. Bronchitis is also somewhat similar and it will be limited in time. So there's not something which happens again and again over a period of time. Any respiratory symptoms such as breathlessness or wheezing or episodic cough which lasts for sometimes more than a week and it keeps on coming repeatedly, so several times a year or all the time in the year, more in the night and early morning, often more during a change of season, one definitely would consider possibility of asthma. And what, so you said pneumonia, bronchitis, and asthma. And what is the last one you asked for? Something else. Did you mention a fourth condition?
Yes. No, I was just asking you that, how would someone differentiate between pneumonia, bronchitis, and asthma?
Right. So one is the pattern of its occurrence. The presence of wheeze is often reported by parents, and so in an older child, the child himself would report, would go in favor of asthma, especially given a sequence like this. An acute bronchitis can also present with wheeze. And sometimes an asthmatic episode is triggered by a viral infection. And in very young children, they do tend to wheeze post a viral infection. So a very young child may be a little difficult to differentiate between asthma, which will reveal over a period of time, and versus just wheezy child, which is with a upper respiratory tract infection. If the pattern is consistent over months and years, then it's very clear that this is asthma. The history taking is the most important part of diagnosis of asthma. And of course, we can follow it up with investigations.
Right. Dr. Nangia, do all people who have asthma, do they all feel the same symptoms, or different people could have different symptoms?
See, the common symptoms of asthma would be cough, sometimes a sticky phlegm coming out, breathlessness, chest tightness, and wheezing in the chest. These would be the common symptoms. These symptoms could vary from time to time. The most important thing in the diagnosis of asthma is variability. This variability would mean that sometimes all these symptoms could be there in the morning, may not be there in the evening, and sometimes would be predominantly in the night. There could be variation as per the months, as per the days of the week, as per the seasons of the year. So it's a lot to do with the variability. Largely, the symptoms would be similar, except in patients who have a cough variant asthma, who may not manifest in terms of wheezing and breathlessness, but it could just be a cough that they could be presenting with. But more or less, the symptoms would be similar, but there would be a variation in their presentation, in their timings. Also, 70 to 80% of these patients usually present with history of allergies. It could be skin allergy, history of allergy in the family, and as well, history of cold, running nose, blocked nose, so nasal symptoms, coryza as we call it. So these are also symptoms that are very commonly seen in patients with asthma.
Dr. Satyanarayan, what would be the key pointers that new parents should keep in mind to ensure that their kid is saved from asthma? Because most of the time, new parents with newborn babies do not even understand that the child could be facing asthma.
So asthma is a polygenetic disorder. There is what we call as GWAS, genome-wide association studies. And you have come up with many genes causing the same type of symptoms or asthma. And there is not a single gene that can be avoided. Now, parents should feel reassured that asthma is not a fatal disease as it was many years earlier. Asthma can be treated very well, and a scientific rationale does exist for optimal control of asthma symptoms and treatment, and also to prevent the long-term outcomes. Therefore, I think talking to their family physician, talking to a respiratory specialist may go a long way, and there should not be despair or feeling, the kid is turning out to be asthmatic. No, I think there is wonderful medications available apart from inhalers. There is also newer medications called biologics, and there are plenty of methods to overcome asthma in the long term.
Dr. Kandi, we've seen that asthmatic patients, they find more difficulties, or they're advised to stay indoors and avoid outdoors what are the kind of activities that you recommend that the asthmatic patients should be avoiding?
Yeah, asthma patient, first he must identify the triggers which predispose to an asthmatic attacks. The triggers may vary from the dust, dander, pollen, and maybe pets, carpets, and strong odors, and extreme weathers, psychological stress. It can vary any specific triggers. When they expose to certain allergen, they will get an attack. So we advise them to avoid those triggers and the indoor atmosphere, because in a day almost 6 to 7 hours they will be in the bedroom. One of the most common trigger in India is a house dust mite, which is in the pillow covers and bed sheets. So we say that they have to clean the pillow covers. They put the pillow covers once in a week into exposed to hot, and so that they can avoid this house dust mite. One more trigger is a damp. So when there's a dampness, there's a scope for the fungus, which can exacerbate the asthma. And some more thing is, you will do puja. In Hindus, they do puja. Some of these arts, instant sticks and harati, what you give, they also can predispose to an asthmatic attacks. And particularly in cooking, a lot of these smells will come. So they will ask them to use the exhaust. And when you use sweeping, the dust is rise. So we'll ask them to swab instead of sweeping. So you have to, asthmatics can get an attack while they are indoors. They think that they are indoors, they are safe. The indoor is also a lot of allergens is there in India, and as well as outdoors also. One more important thing is if a smoker is there, if a spouse is a smoker, that is and his wife is a asthmatic. So the what you call as an environmental tobacco smoking, that is a passive smoking, can trigger the asthma. So the thing is that the people should avoid those triggers. They should identify those triggers and try to avoid those triggers. As of course, you can't avoid completely triggers. At least you minimize the exposure to the triggers, or you ask them to use mask when they are going to the outside, this dust to prevent the exposure. And always ask them to keep an inhaler along with them when they are going out, because when there is an attack, you have to use those inhalers. They should go without a money purse outside, but they have to, in asthmatic, we always say that don't go out without an inhaler device. So these are some of the precautions we advise. So most of them are the triggers. You try to avoid. Some people will have a pet dogs. So these pet dogs, so the hair in the pet dogs can be, so we'll ask them to avoid those pet dogs. And some people are fond of plants, indoor plants, and some of the pollen may be allergic. So we'll ask them to try to avoid those things. Of course, let them keep the mental stress, avoid the mental stress, because mental stress is also a trigger. And in India, one more common cause of exacerbation of asthma is a vitamin D deficiency. If they stay in the long time indoors, if they don't expose to sunlight, there will be a vitamin D deficiency and the asthmatics. In fact, we have done a study on vitamin D and asthma a long time back. There is a direct relation between vitamin D and asthma. So that's what we advise these things.
Right.
Harvinderji, in continuation with Dr. Kandhi has explained so very well, I'd also like to say that there is an entire entity called exercise-induced asthma.
Yeah.
For people who are going in for exercising, they sometimes develop asthma, especially when they're going for a jog or a run. And this could happen starting from about 15 minutes after the onset of exercise till about 4 to 12 hours after the cessation of exercise also. So people need to be aware of this kind of an entity and need to carry their reliever inhaler with them. Of course, we'll come to the therapy, what therapies are to be used in these patients. But yes, they should keep that reliever inhaler with them and take 2 puffs from that inhaler 10 to 15 minutes prior to the onset of the exercise.
Okay.
So we need to remember this exercise-induced asthma as an entity itself.
Right.
And they should go for a graded exercise instead of directly. So take an inhaler 15 minutes to half an hour before they start the exercise, and they go for a graded exercise instead of directly going to that.
Right.
So, since we are talking of exercise-induced asthma, one thing which is important, and perhaps one wouldn't think of it in this weather, is exposure to cold, dry air. So people doing exercise where they're exposed to cold and dry air, that could be the trigger to produce an asthmatic attack. So that's something to be taken care of.
So since we are talking of precautions, and we've recently just, or we are coming out of a pandemic, hopefully we are coming out of a pandemic. Are there any special precautions that the asthmatic patients need to take care of? Because, I mean, we've seen the COVID-19 virus and the different mutants coming out, after a couple of months. Is there some specific precautions that the asthmatic patients need to take care of? Anyone who wants to go for it, sir?
Can I?
Sure, sir. Please.
In fact, Gina has given a guidelines of management of asthma during the COVID pandemic. Particularly, some of the guidelines they have given is to do a spirometry test for confirmation of the asthma. So they are advised us as far as possible try to avoid spirometry because you have to blow, it can disseminate the virus, and it is infectious to the person who is doing the next one. So they are used to go by other tests like Pneumonia or by taking history, one thing. And one more thing is using a nebulizer. I think most of the people use a nebulizer during the asthmatic attack, during the COVID pandemic. They are advised not to use the, as far as possible, the nebulizers and use metered dose inhalers instead of this. Fortunately, during the COVID pandemic, the asthma exacerbations have come down tremendously because one of the reason may be because we have seen a lot of lockdowns, a lot of pollution has come down. This is where asthmatic exacerbations have come down. And the other thing is the asthmatics use the inhaled steroids on a maintenance dose. In fact, we are advising the inhaled steroids as one of the treatment of the COVID pandemic, the COVID, in the mild case of COVID also. That may be the reason. And one more thing for the diagnosis sake, if they go to hospital, they may catch infection. So we are advising teleconsultations for follow-ups instead of a direct physical visit. We are advise them to go by tele-visits and ask them to monitor their asthma using a peak flow meter device, self-monitoring of the asthma. These are some of the precautions we have.
Dr. Satyanarayan, I mean, since we're talking about infection and since we're talking of COVID-19, one of the major causes of the virus was seemingly by touching things, so typically when somebody goes out and is touching a handrail or is in an elevator, so he's pressing the button, etc., and they're using the same hands to touch their nebulizer because that's what they need, with them all the time. What are the precautions that you recommend for asthmatic patients to avoid catching a virus because of such kind of issues?
First of all, to clarify, with respect to the pandemic, the touch mechanism or fomi transmission has not been proved. It is mainly aerosol kind of droplet infection or aerosolization. So as Dr. Nangia did point out a very, very valuable point, that there is variable symptoms. So symptoms can change and we may attribute that to having, touched a surface or whatsoever. So also during the pandemic, I think people started wearing masks, which is a wonderful thing. and that is probably kept the exacerbation rate low, and asthmatics have had the benefit. Cleaning the device, inhaler, should be a daily norm rather than something related to the pandemic. There are other reasons. During the pandemic, the virus will enter through the lung through particular receptors, TMPSS2, ACE receptor, and so on and so forth. These receptors are knocked out to a large extent in asthmatics. The beginning of the pandemic, there was a fear that people with pre-existing lung disease are more prone to get severe COVID. The reality is asthmatics did actually do quite well. And as my other distinguished colleagues pointed out, there were studies that people who take inhaled corticosteroids through the inhaler were largely protected, whether it was because of that or because of the asthma dynamics on the airway lining. So absolutely myth, do not go by the fomite theory. It will be in the social media, but not scientific. Clean the inhaler, clean the nebulizer as you do once a week, and ensure that the cap is always on the reliever or the preventer. That's all you need to do. Wash hands, and that is very good.
Right. Dr. Nangia, let me come to you. One of the things that, while I was researching for this particular webinar, I realized on the internet, there were a lot of issues when people felt that during pandemic, as a precaution, the asthmatic patients should increase their dosage of the inhaler. Now, is that a correct thing to do?
See, basically what is important is to keep your asthma or any other comorbidity under check, whatever it may take. Whether it is diabetes, hypertension, chronic obstructive pulmonary disease, or asthma for that matter, what was important is that you should be on your regular medication so that none of your underlying diseases or comorbidities are in a stage of uncontrolled situation. So the idea is to control it. Now, control it may vary from individual to individual. As far as asthma is concerned, when do we call asthma as being under control? We call it if somebody has daytime events of less than 2 per week, nighttime events of less than 2 per week, the usage of inhalers is less than twice per week. So this is when you label somebody as being controlled in their asthma. Now, whether it takes them to take the inhaler or the dosages twice a day or 4 times, double the dosage, whatever the dosage may be, of 1 inhaler, 2 inhaler, 3 inhaler. So that all will depend and vary from an individual to individual. But what is important is that whatever it may take, you need to keep your asthma and the symptoms related to asthma under well-controlled situation, not only in the pandemic, but even otherwise. See, in the pandemic, of course, there's also an advantage that we've been using these inhaled corticosteroids as a form of treatment for some patients whose cough was not settling or fever was not settling despite the first 5 days. So in them, it has been used as a therapy also. But even otherwise, as a preventive strategy, it's important to keep your asthma under control. And to keep the asthma under control, the mainstay of therapy is the use of inhaled corticosteroids, ICS as we commonly call them, in the form of inhalation. So that is what we need.
Dr. Sirkar, what, according to you, should be the checkpoints that should be kept in handy by any asthmatic patient?
Okay, I'll answer that. I'll just add to what was being discussed before. My own clinical story that I'm facing from patients is many of them have reported increase in their symptoms of asthma after an episode of COVID. Now, whether it was the emotional stress which triggered this or there's something biochemical which happened deeply, we don't know. I think more will be revealed with time. I've had several people coming and telling me that the first asthmatic symptom.
In fact, our experience also the same. Post-COVID, a lot of hyperreactive airway diseases are coming. There is increasing incidence of
it's opposite of what we have been hearing, that, probably because they are on inhalers, they are less incidence of COVID. We're not too sure because the number of people getting it right, left, and center was so huge. It was very difficult to differentiate whether asthmatics got it less or not. But we do see on an outpatient that they are having increase in their symptoms ever since the episode of COVID. So that needs to be kept in mind when we see patients in the outpatient. Now, coming to your question, if you can just repeat that question, which you just asked me.
So my question to you was that what are the checkpoints that an asthmatic patient needs to keep in mind and should be keeping it handy to understand when is he having trouble, etc.
To understand when they need to escalate therapy or see a physician.
Yeah.
Right. So the first thing is change in symptoms. So more acute symptoms. Now symptoms could be in terms of cough, or symptoms could be in terms of more breathlessness. Symptoms could be in terms of limitation of exercise. They could easily go for a walk for 5 kilometers and suddenly they're not able to walk even half a kilometer, for example. Then nighttime symptoms. So they're waking up with respiratory symptoms, whether it's cough or wheezing or breathlessness, and need for increasing use of their inhalers. So these are all kind of things which indicate that asthma is getting out of control. If they are not controlled quickly by the medications already prescribed, because most of us would usually tell our patients what to do if they get increase in symptoms, like add some additional medication. If they're not getting well, they need to see a respiratory physician at the earliest, or their regular physician the earliest, before it goes out of control. That's one. The other thing to remember is that the triggers. So, for instance, upper respiratory tract infection is often followed by increase in asthma severity. Increase in pollution levels. Whenever the pollution levels go sky high, at least in NCR, we see suddenly a lot of our patients who are being stable coming back for consults. So if you know that there is a lot of pollution, and one needs to be careful and follow the prescription to the every T and I absolutely perfectly. And in case it's getting out of control, see a physician. The other common situation where the symptoms increase, and those are high pollen count days. Now, in Indian scenario, I'm not aware of a daily pollen count announcement, just like the weather is. In a lot of Western worlds, they give you an daily update that, okay, pollen counts will go up. And those who have history of being allergic to pollens, they need to avoid going out if they can, and take necessary precautions. These are some of the things they need to keep in mind.
Dr. Nagia, there are different triggers, and we also understand that there could be different challenges that people are facing when asthma happens or an asthmatic attack happens. What are the signs that one must keep in mind when you know that it is now important for the person to be taken to the hospital? And this is more so because people are scared about going to the hospital during pandemic, etc., because they're scared to catch other infections from there. So when is a time when they are sure that, it is now time to take the patient to the for professional help?
Right. So first of all, I want to say that, people should not have any kind of apprehension of coming to the hospital thinking that they could acquire another infection. What is important is to treat their own illness right now and not bother about the secondary complications of coming to the hospital that may happen. As it is, as of now, yes, when we were talking about the Delta wave, yes, there were apprehensions. In any case, beds were not available and all that chaos that we were going through. But right now, it's a very mild variant. So there's nothing to worry about per se. So one is that do not neglect your symptoms. Second is that this pulse oximeter is very, very handy kind of an equipment that you have these days. It barely costs 1,000 rupees or 1,500 rupees barely, and gives you a lot of information. So if your symptoms are not coming under control, that means your cough is not settling, your breathlessness is worsening, you just need to check your respiratory rate, which is going up beyond 20 per minute. Check your pulse rate if it is more than 100 or 110 per minute. Check your oxygen saturation in an asthma patient if it is dropping below 95%. If you're feeling severe tightness in the chest, becoming drowsy, dull, I think these are the symptoms that you need to watch for and rush to the hospital immediately before it is too late. Do not worry about anything else like secondary infection or something. Your asthma itself can be fatal if not treated in time. So it's important to reach the emergency in time. And these are the various signs, as I said, that you need to look out for.
And my next question is open to all. I mean, I would whoever wants to answer, because this is an important question, which has come from our audience, and this question is related to that: do people, by taking inhaler regularly, does their body become habitual to that particular inhaler? So they have two points that they want to ask. One is that would the medicine over a period of time become ineffective? And the other side is, would your body become dependent on this inhaler? So whoever wants to go in first.
Very nice common question from the patients. And the answer I always give is to quote my own professor. You would say, you would tell the patients when they would ask this question is that once you get used to riding the Mercedes Benz, it's difficult to be traveling on DTC bus. So once they would say, what do you mean? It's very simple. You are now carrying 20 kg extra weight on your back. Once the inhalers have unloaded and made your disease much better, then you will hesitate to again carry that 20 kg weight. So that is the only dependence. Otherwise, it's not alcohol, it's not marijuana, it's not any opioid that one would get addicted to. Only thing one needs to get addicted to is excellent control over asthma. And it's like any other chronic disease in these patients, barring an occasional one who is completely episodic. And just like hypertension or diabetes is to be treated regularly and not when things go out of control, similarly, asthma needs to be controlled on a regular basis. There is no addiction involved in it. It is simply that it gives good clinical control, and therefore one needs to continue with the medication.
So what I usually tell my patients is that, this is just another form of delivery of medication. Like you have tablets, syrups, injections, so are inhalers or nebulizers for that matter. It's basically an inhaled therapy as we label it as. The advantage is manifold. First of all, you're giving a much lower dosage. The dosage is probably 1/1,000,000th of what you would give in the form of a tablet or a syrup. The dosages of a tablet are in milligrams. The dosage in an inhaler is in micrograms. So 1/1,000,000th is the dosage. Second is the site of action is exactly where you're delivering the drug, meaning the lungs are the organs which are involved when you're dealing with asthma. The airways are the major portion which is involved. So when you give inhalers, the medicine is going directly into the airways and affecting where they're supposed to act. Rather than when you give a tablet or a syrup, it goes through your stomach, into the bloodstream, into the liver, kidneys, causing so many side effects. As a result, the side effects are much lower because, again, we are delivering the medication exactly where they're supposed to deliver. So the side effects, and it's in 1/1,000,000th the dosage. So the side effects are also much lower. So one, that the dosage is so much lesser. Two, that it is directly acting at the site where it is supposed to act. And three, that the side effects are much lower, make it a much, much safer form of giving a medication rather than in the form of tablets or injections or syrups. So from that point of view, yes, it is the best medication and the best way of delivering the medication into your system for asthma control.
If anybody comes to me with the same question, I think this is the most common method what we come across. I will ask one question directly to my patient. Are you brushing your teeth daily or not? So do you avoid that it's a brushing teeth become habitual? So it is a good habit. Using an inhaler is a good habit. And as rightly said, it is a local action, side effects are less, and there is a scientific evidence is there. And suppose if you have an eye infection, we use the eye drops. Similarly, the problem in the asthma is in the airways, as rightly said. So there is a direct delivery to the airways. So in that way, we will explain to them, and it is not a addicting. Addiction is for the drug, not for the device. So the drug which is there is not a addicting drug as already.
Got it. So I have a next set of questions, which are the questions which we sent to you earlier. And these are questions that we had collected from our audience, especially for this particular conversation. And some of them could be very, very basic, but some of them are very...
Vaccination also for their influenza shots every year, which will prevent them from catching the simple cold and viral infection, which can trigger off an asthmatic episode at any time. So these are the basic precautions that they should be taking, especially at the time when the air pollution levels are quite high.
Dr. Satyanarayan, there was a mention of mental well-being and mental health. And how does mental health trigger off asthma?
I may rephrase that question for myself. See, by and large, in asthma, there is bound to be certain anxieties, as was discussed earlier. Anxieties on the long-term outcome, anxieties on the quality of life, anxiety of activities, and so on and so forth. Also, when you use reliever medications in hospital, and they looked at prevalence of anxiety issues in patients with asthma, yes, slightly higher percentage of anxiety found in them. Therefore, in a comprehensive asthma management, there is need to look at anxiety quotient as well. And anxiety does trigger, increased rates, but that should not be the sole reason. There are a number of other reasons why the asthma exacerbation happens.
Okay. Dr. Sirkar, what is an asthma action plan? What does it aim to do?
Okay. So this is basically a prescription by or guidance from the treating physician, usually respiratory physician, as to how to manage asthma at home. So the patient is instructed, and when we say action plan, one would usually give a written plan, apart from, of course, telling verbally that this is your regular medication. This is the extra medication that you would need, the rescue medication once in a while. These are the signals that you need to look for that the asthma is getting out of control. In case they're getting out of control, these are the steps you have to take. This is in substance, some substance of an action plan. So this basically one puts the responsibility and gives certain power to the patient to manage their treatment. It's just like teaching a diabetic patient how to take the insulin doses. So just like sugars can go up and down, similarly, asthma can go up and down. Typically, asthma is a variable disease, like Dr. Nangia mentioned very early on. So same medication every day may not work. So you may need a top-up medication. You may need extra doses of your regular medication to control asthma symptoms. And this is given so that step by step a patient can take care up to a level where they are usually also instructed when to access healthcare. So when to come to an emergency, when to seek an appointment with a respiratory physician to change medication and intervene. So that's the action plan.
Dr. Satyanarayan, how can people monitor asthma at home. Are there some kind of equipment or tools available for people to monitor their asthma or the levels of asthma?
Yes. There does exist a lot of equipments and scores and so on. First thing is to monitor asthma scores. Check out how many times you are using the reliever. Are you feeling the need to use more relievers? That is one. Second, use of peak flow meter. Of course, that is a discipline in itself, because the patient will need to meticulously maintain and look for variability in a peak flow meter. Peak flow meter is a simple device. Based on the height and age, the person is able to blow out certain amount of air out in 1 second, and that is reflected on the meter. So the peak flow meter is going to be, you know, what is normal for you, and that will be defined by your doctor. So keep a track of that. If there is 1/3 less from the baseline, then it is an indication that asthma attack is brewing up and you need to implement your asthma action plan. If the demand for reliever is going up, then you know that there is no point sticking and waiting at home, and you need to visit a emergency. So doing the peak flow is one way, having the scores is another way. Third is to go by instinct. You know that your asthma is well controlled, then you have no symptoms. So the other thing what your doctor can do in a jiffy is, they may, when you walk in, they may look at your exhaled nitric oxide. So these are some of the tools. And I think it is very important that patient self-monitor their asthma severity or stability, just like how we kind of check our blood glucose at home.
So my next question can be taken by anyone. Can children outgrow asthma?
So it is a common asthma among the parents. Outgrow is well and good, but normally when they go, the lungs also increase in size. Some of the symptoms may have asthma, disease, specific disease. They may have revisions, but they have and one more thing we share is
Dr. Gandhi, your voice is cracking. Is it just me, or is it everybody else is also facing a problem?
The same thing. I mean,
yeah. Can someone else, in the meantime, can someone else answer this question?
Yes,
can children outgrow asthma?
I'll do that. So as a thumb rule, 70% of children by the age of by the time they reach teenage years, they've outgrown their asthma, quote unquote. I like to put that under quote unquote. Some of the changes are because the caliber of the respiratory tract is growing, so it doesn't narrow so much. Two, there is a immunological changes happening inside the child, so the immune system is getting more mature, and the unusual way in which the immune system works in asthma is the allergies. So some of it may settle down with time. However, I always tell that we can't predict with certainty as to who would be in the 30%, who would be in the 70%. That's number one. And number two, even those 60-70% who so-called quote unquote grow out of asthma have a lifetime risk of again developing symptoms at a later age. So since the disease is essentially programmed into the genes, so genes remain the same throughout the life. It's just the gene expression and interaction of the individual with the environment. So yes, unlike people getting asthma in adulthood, there's better chance of a patient who is a child to grow out of the asthma symptoms, but not everybody. And even those who grow out, may again get symptoms later on in life. Not everybody, but yes, some of them would.
Dr. Nangia,
Some of
sorry,
them may attack. So you can't say whether they have outgrown. The symptoms, they may be a remission.
I think Dr. Kandi is facing a technical issue. Dr. Nangia, can dietary supplements cure asthma? Is that a possibility?
Well, as far as cure of asthma is concerned, as we all have been saying, that it's a chronic ailment. It doesn't go away once it develops and comes into full-fledged form. Just like any other disease like diabetes, hypertension, heart disease, you need to keep it under check. So one thing is that don't expect that you can grow out of asthma. Yes, teens can, but not adults. Once asthma comes into play, then you have to keep it under control, keep it under check. That is one thing. As far as nutrition is concerned, nutritional supplements are concerned, they can only aid to some extent. Like if you're taking a good diet of rich in vitamin C, antioxidants, so they may protect you from developing a viral infection, which is a very common trigger for an asthmatic episode. But to say that you take a particular diet and you'll be able to get out of your asthma will not be right, actually.
And do you think that, Dr. Kandi had mentioned that when people smoke, even the passive smoking could be dangerous for asthmatic patients. Now there are asthmatic patients who are smokers themselves. Do you recommend or strongly recommend that they should quit smoking? And I believe quitting smoking is a tough thing to do. So what is the best alternative for them as a precaution to trigger asthmatic attack?
No, so it is very, very important, and we always strongly recommend to all our asthma patients, all our COPD patients to quit smoking. I mean, that is like the first step that you would do for all your patients, in addition to advising the medication. Because unless you stop the triggering factor, the asthma will never come under control. You will keep suffering. Temporarily with the medication or a high dose of medication, you may be able to bring it under control to some extent, but it will never stay at that level. It will keep coming back, keep bouncing back. Back and forth. So quitting to smoke is very, very important. Now, there are various measures that one can take. One, of course, is the non-pharmacological and the pharmacological measures. Non-pharmacological would include a psychotherapy sessions with our counselors, which we do regularly for our patients. Amongst the pharmacological measures, we have nicotine that can be used, nicotine replacement therapies that are now available, and also certain medication that can be used. So there is a whole gamut of methods that can be employed in helping somebody quit smoking. It is no longer as challenging as it used to be. I always tell my patients that the day you've developed that will to quit smoking, come back to me and we'll get it sorted.
Got it. Dr. Satyanarayana, now a lot of people who are asthmatic, they are also very keen outdoor explorers, enthusiasts. Does that mean that if you have asthma, you need to give up your athletic activities?
Not at all. I think the idea is always an optimistic one, and it has to be kind of guided by ensuring a definite quality of life. That is what we call as asthma despair, and that should not be allowed to happen. However, there may be instances where somebody, in addition to asthma, may have an overexpanded lung, especially in the top areas of the lung. And for them, as a precaution, certain activities like scuba diving or very high altitude may not be advisable, but that should be case by case basis and not a generalized decision. So I think any restriction should be very carefully considered, discussed, and then told to the patient or the person in question. And it's not a generalizable thing. What is generalizable is to ensure absolutely better control, and with that control, there should not be much difference between that individual and the other individual. As there is exercise-induced bronchoconstriction, there is also a subset of patients. We do a test called as cardiopulmonary exercise test at Manipal for swimming athletes and volleyball and other athletes. As a project we do, and we also do it to routine public if they are sports enthusiasts. And what we see is few people have normal spirometry, that is they sit and breathe into the machine to know the power of airway emptying. That may be absolutely normal, but on a cardiopulmonary exercise testing, we may find that they do indeed have airflow limitation. So adequate counseling is required and it should never be generalized.
Right.
I will narrate one example. In 1984 Olympics, 59 asthmatics participated in the Olympics. Out of those 59, 41 got gold medals. So asthma is not a hindrance for any activity unless otherwise exercise-induced asthma. Asthma patients can live normal life on par with others.
Right, right. Dr. Sirkar, I want to ask you, can asthma be fatal? And if yes, I mean, I would like every one of you, anyone who wants to share, that certain cases in which you have seen your fatality because of asthma. So, Dr. Sirkar.
Yes, asthma is can be fatal, and although fortunately it is rare, but it can definitely be fatal. And the triggers which can lead to fatality, the most important one is delayed access of healthcare. And the reason for delayed access often is one, patient ignoring the symptoms till it becomes very bad. Two, overuse of rescue medication. So they keep on nebulizing, keep on taking their rescue medication and do not access healthcare. Because an acute attack, which is requiring very high doses of rescue medication, things can just go out of control before the patients know. So the two important thing is delayed. Most important thing is overuse of rescue medication and delayed access of healthcare. The other very rare situation is somebody who has a severe allergic reaction, and therefore asthma is part of that allergic reaction, in which case they can also have a fatality. However, the good thing is if the patients do reach good respiratory center or any hospital where appropriate medications are initiated early, and sometimes we may even need to put such patients on ventilators. We've had patients needing with such severe asthmatic attack that they ended up on a ventilator, but with medication and with care, most of them would then eventually come out. But important thing is they should not delay accessing good medical care. That's the important factor. Over-reliance on self-medication can itself lead to fatality.
Dr. Nangia, I'm sure you're seeing all kinds of patients coming in, and today with access to Google, people are getting all kinds of information. Some of them good information, but a lot of it is bad information. You know, what are certain myths that you have come across that people have in their minds and they're so oblivious to the reality of asthma? What are these some myths that you would like to bust today? So you're on mute, sir.
I think the most common issue that patients feel is that they consider asthma is a stigma still. You know, even in this modern era, they feel that if they have developed an asthma, then a girl may not be able to get married into a good family, or it will be a major handicap in their way of living. As we've all been saying, that now with proper controls, regular medication, any kind of asthma can be brought under control, and you just need to continue with your therapies regularly. Second most common myth or second most common problem that we face is that patients take their treatment only for a short while till their symptoms last and then they discontinue it. Well, I always explain to all my patients that asthma also needs to be managed on a regular basis, long-term basis, chronically. It has to be kept under check. The inflammation, once sets in into the lungs, does not go away with just a treatment of 1 week or 2 weeks or 3 weeks. You need long-term treatment for it. And the best way of delivering this treatment is the inhaler. So the third most common myth that patients feel is that they may become dependent on the inhalers, which we've already discussed. So these are the common things that we face. These are the common problems that we encounter in our OPDs.
Dr. Satyanarayan, do you feel that there is a need to impart a lot of awareness because of exactly the same issues that Dr. Nangia spoke about? And what are the ways in which we can maximize this reach of awareness so that the disease or the fatalities because of lack of awareness can be reduced?
As long as there is a lot of myths and misinformations easily available, I think there is much more greater need and demand for authentic medical information to dispel these myths. And that is exactly what this forum is trying to do. So how can we achieve this? Is having this kind of interactions with the public at large on a regular basis, looking at incorporating NGOs at district level, the pulmonology associations. We have now statewide associations. In my state, the association did a kind of marathon and message dispersion activity couple of years pre-COVID. So COVID had put a large lacunae in the direct interaction methods to some extent, especially the mass gatherings are a no-no, have been a no-no. So I think it is also government and private coming together, hospitals, health authorities coming together to drive the same message. There should be easy availability. I think even the pharmaceutical industry is coming out with videos on correct usage of inhaler technique and things like that. There is need for once in a while celebrities from the medical world, from the film world, from the politicians to all come out and give the rightful message and positive message. And that is when we can destigmatize asthma. As Dr. Nangia was saying, if you say to a patient that you have diabetes, they may accept. But if you say to a patient bluntly that you are asthmatic, it is not well taken or well easily acceptable. So we need to cross that and convey to everyone about the realities of asthma, the amount of medications available, the discipline that they need to practice, and so on.
Dr. Kandi, what are some of the things that policymakers in our country need to do to not only create an awareness for this, but to make efforts to reduce the asthmatic cases in the country, if it is possible? What do you expect from the policymakers in our nation?
One of the major problem is availability of inhalers to everyone. So one of the reasons why the people stop the inhaler is they think that they are costly. If you use the cost of inhaler, and if you don't use the inhaler, the cost of 1 day admission, it is almost 10 years cost of the inhalers. So still in the rural areas, there is lack of awareness, lack and availability of the inhalers, proper use of inhaler technique. There are several things. I think government should take a proactive step. We have several control programs. We have a national TB control program. We have a national malaria control program. Why not a national asthma control program when 1 lakh people are dying due to asthma in India, which is a treatable disease, preventable disease, and you can, unlike diabetes, there are a lot of complications are there. But asthma, as long as it is under control, it is almost like a normal life. There is no change in the normal person and asthma person. So the government should take more initiative, see that the inhaler technique should be disseminated, the knowledge should be disseminated through various medias. And one more thing is the environment, because the environment also play an important role in asthmatic attacks. How to bring down the pollution, how to prevent the smoking in the public places, environmental tobacco smoke. These are the things policymakers have to take, and the pollution control board has to take to prevent the pollution emitting vehicles. That is entirely unless there is a strong political and administrative and government commitment, the asthma, you have to, one more World Asthma Day, you have to celebrate and you talk, and the same thing will happen. So the government can do, if they have a will and vision, the asthma control is not so far, which is very needed. So with the cooperation of all the NGOs, the media, and the public should come forward. And still, Nanya told, there still is a stigma. The asthma is still a stigma. That is why they are not coming forward, because using inhaler in the public, they can use a tablet, means they can use somewhere. When you are using inhaler in front of so many public, they say, oh, he has an asthma. So that is why the people should, the asthma, that way now the film personalities are also coming in front of the public and saying, using the inhaler in front of the public. So this is a long way to go. And the government, if they have will and vision, I think definitely they should make it available, inhalers at all the government hospitals free of cost. When they're spending so much money, why not? The inhaler should be accessible, and the technique should be taught properly. And the other triggers, which are all the triggers which can be prevented, where the government make a policy, can bring a change in the triggers, the government should act.
Anyone else would like to go in for this or share what they expect the policymakers to do? Dr. Nangia?
Yeah, basically, I think it's awareness that they need to spread. Second is bust all the possible myths. Third is provide them with a safe environment where people can breathe properly. So ultimately, that means that the air pollution needs to be brought under control. So we need to have some kind of a program to be able to control the air pollution, which is a major hazard to all our asthma patients.
Right. My last question for the session is, will there be a cure for asthma? Because I understand that, we're taking medication, and somebody mentioned that, you can suppress the triggers, but you can't 100% be asthma free. Is there enough happening in the R&D? Is there enough R&D efforts happening in this field? And do you think soon there would be a cure for asthma?
Well,
Yes,
very unlikely that we'll have a cure, quote unquote, very soon, simply because it is a genetically programmed disease and multiple genes are involved. So unless somebody finds some way to switch off some genes or modify certain genes, which is a long time to come, we are unlikely to get a cure. However, what can change the intensity or the suffering from patients is decrease in air pollution. So that's a doable thing and the need of the hour, not only from asthma point of view, but in general for many other diseases. So that's doable. Gene editing or gene modification is way off in future.
Anyone else?
I think a lot has been done, and currently on the way, the genome-wide association study group is there. The challenge is you have identified, say, 100 genes, and all are 100 different genes, but they can cause the same kind of disease profile in an individual. Therefore, which gene do you turn on, which gene do you turn off? You may use a vector to bring about a change. So the cure is going to remain a myth at this point of time. I think the focus is not to look for a cure. The focus should be to control asthma very, very well. And as all my esteemed colleagues did point out, there are remediable factors, non-remediable factors. Remediable ones are the ones that we should focus and work with the public, with the policymakers, with the NGOs to establish a better control handle on asthma.
So while
As on today,
coughing and we may not be
as on today, the cure for asthma is a daydream. So, but future, we don't know the genetic engineering techniques because there are multiple genes are involved. I don't know in future what may come. But as on today, effective control of asthma is almost equal to cure. You can say if asthma is control is almost equal to a cure. The definition may not satisfy, but there is no difference between a cure if it is under effective control. As long as the asthma is effective control, I can say that it's almost we have achieved a cure. But technically speaking, the cure, because it's a genetic disease, multiple genes are involved, you have to programming the genes. I think, I don't know, future only will answer, but as of today, it is going to be a daydream.
Dr. Nangia.
So, while we have a very pessimistic attitude towards a cure for asthma, I would say I'm very optimistic with the newer modalities of treatment of all our patients is concerned that are available to us today. We've moved beyond inhaler therapy now. We have ways of phenotyping our patients into allergic, non-allergic, Th2, non-Th2 varieties, and then treat them accordingly. We have newer drugs that are available to us, which are in the form of biologics that we use. And then for a certain set of patients, we also go ahead and do what is called bronchial thermoplasty. It's an intervention that is carried out during bronchoscopy. Again, a very simple technique, which you do when you do it in your selected group of patients. And of course, it has to be properly selected after a rigorous examination and investigation. When you do that, it has really very good results. What is also important in the management of asthma is to prevent the triggers. You have to avoid your triggers. If you avoid your triggers, your asthma is under control. If you're allergic to pets, avoid having furry pets in the house, dogs, cats. Avoid accumulation of dust inside the house. So avoid having heavy carpets, heavy furnishings, heavy bed covers, bed sheets. Regularly clean the house. Vacuuming is always better. Wet mopping is better than sweeping. Avoid any dampness in the walls. That usually results in fungal infections and allergies. Avoid being exposed to very cold temperatures, especially in the winter, in the summers. When you are sleeping right in front of the AC, I see a lot of people sleeping with temperature of 16 degrees, 18 degrees, which is not a good thing to do. A 24-degree temperature is just the right thing. With probably a low-speed fan at number 1, that should be able to give you the right kind of an atmosphere to sleep in at night. And of course, avoid exposure to fumes, chemicals, smoke. Quit smoking if you already do that. And even dhoop, agarbatti, these are things that we should be avoiding. Any strong smell can trigger off an asthma episode. Strong emotion, laughing, anger, that could trigger off an asthma episode. So we need to avoid all that and keep a balanced, healthy life. Good nutritious diet with adequate hydration is what we need to do. With all these measures, we can easily keep our asthma under check while we as scientists are still working on a cure for it.
Awesome. Thank you so much. This has been such a useful session. I know we've gone far beyond the time that we had estimated, but in the interest of the people who will be watching this, I am sure that this is going to be super useful for them. And I really want to thank all of you, Dr. Sirkar, Dr. Mysore, Dr. Nangia, Dr. Kandi. I know you are all busy people. It's a working day. For you to take out this much time for us, I must express my gratitude on behalf of BW Healthcare and Business World. Thank you so much for joining us today.
Thank you.
Thank you. Salman, we are good.